First, let me give a huge shout out and thanks to Representatives Robin Kelly and Yvette Clark, amazing women who have come together to make sure that we're focused and have the lens of racial equity and making sure we're closing these gaps, which is so critical that we do. And we have an obligation, I believe, to do that. So this morning we've heard about dozens of pieces of legislation that would take tangible steps toward reducing racial inequalities and moving closer to the elusive American value, equity for all. And again, I want to thank my colleagues for putting this task force together to be able to highlight some of the work that members are doing, but also bring them together so we could see what other members are doing, support each other, and work to get these passed so that we have a future that is more equal and more just. I want to highlight three of the bills that I'm working on to address racial inequity and inequalities. The Energy Resilient Communities Act is a bill Chairwoman Clark and I have introduced to offer $1.5 billion a year in grants to help develop clean energy microgrids for critical community infrastructure. We've seen how climate change is causing extreme weather events such as wildfires, deep freezes, hurricanes, and heat waves. California has been on the front lines of that. Now low-income communities and communities of color are often hit worst by these disasters. So our bill advances energy equity and environmental justice by putting grant applications from low-income communities and communities of color at the front of the line for clean energy microgrid grants. The bill also prioritizes projects that use minority and women-owned businesses to build the projects and conduct community outreach on the programs. Another bill that I've introduced and I'm working on is improving the Social Determinants of Health Act. Social factors like housing, employment, food, pollution, and education level are all key drivers in determining health outcomes and well-being. So addressing social determinants of health is important for improving public health, especially for communities of color. This has been quite a hot topic, but the reality is we got to see action. Words are great, but we've got to get these measures implemented so that we can start addressing these social determinants of health. My bill would examine the social, economic, and environmental factors that drive health disparities and invest in the CDC to address these issues. It would also empower public health agencies and community organizations to continue the critical work of addressing social determinants of health in their communities. Lastly, I introduced a bill called the CHIPP Act, which is the Children's Health Insurance Program. So many Californians I speak to are so reliant on the program to be able to get healthcare access for their children. So we talk about closing the gaps and the disparities in health. It's making sure that everybody has access and our children should always have access. This act that we've introduced, the legislation, will permanently fund the CHIPP program. Nationally, CHIPP provides healthcare to more than 9.5 million children, yet it's the only federal program vulnerable to potential lapses. And so this is one component that we need to get done. I'm thrilled that it's currently in the Build Back Better Act to ensure that low-income children will always have access to quality, affordable healthcare. And I think it's through task force like this and voices through this task force which helps amplify the need for this legislation, which is what helps get it into legislation that we're working on right now in the Build Back Better agenda. And I want to also echo comments and sentiments on working on investments at ports as somebody who represents the Port of Los Angeles, which is, we call America's port. Anything we can do to help address the inequities by communities and surrounding port communities. 40% of Americans live within 3 miles of a port. Is something I wholly support and work I've also done work on. And so with that, I just wanted to thank both of these amazing congresswomen that I'm pleased to call colleagues. Thank you both. And with that, I'll turn it back over.